Hello, it's Dr. Gay from First Look MRI, and this is a 32-year-old male who complained of hip pain for about 9 months. He had difficulty walking and finally came to get an MRI to see what was going on, and we note that there is significant asymmetry. This is the patient's left femoral head and neck. We see some fluid in the left hip joint. This is an axial view. We see again that same abnormal signal. And on this view, fluid or anything with edema or extra cells is bright. So we have fluid in the bladder that's bright, and we see this femoral head is bright. So this is reactive edema throughout the left femoral head and a little bit of fluid in the joint. And also there's an area of darkness right beneath the articular surface. And this is a region of necrotic bone, or bone that's lost its blood supply and died. And we call this condition avascular necrosis or osteonecrosis. It's typically in people between 30 and 50 years old. It can be associated with an old injury where the blood supply is disrupted and the piece of bone dies from a lack of blood supply, or it's associated also with alcohol abuse, and steroid use can also cause it. So this is not a very common cause of hip pain, but something that's very serious. When the necrotic bone gets really bad, the articular surface can collapse, and then they have to do a hip replacement. And this is pretty extensive. This patient has more advanced avascular necrosis. I'll put out a couple more views here. This is a T1 weighted view. You can see it looks a little bit different, but this whole weight-bearing articular surface is involved, and there's a little bit of cortical step-off right there, so early collapse. And when it's this bad, they may want to go in and just replace the hip. When it's not bad, they will put a core decompression device in here. They'll put a trocar in and take out a wedge of bone, a little cylindrical region of bone, and they hope that lets blood supply get reestablished in there. But when it's really bad, especially when there's deformity, then those do a hip replacement. But this is a case of avascular necrosis or osteonecrosis. The patient did not have any history of prior injury, so undetermined why. And thank you very much.